The government assures that the poor will have greater access to better health care. This with an over 45% increase in the proposed budget of the Department of Health for 2014. More of this report from Freddie Abando.
The World Health Organization standard for budgetary support for health all over the world is 5% of the gross domestic product. The Philippines, under the Aquino administration, is moving in this direction with a 45.5% increase of the Department of Health for 2014. Next year's outlay will amount to 87.1 billion pesos. Taxes collected from the reformed sin tax law has provided the resources to cover the budget of health insurance for the poorest families in the country. The budget is 35.3 billion pesos, which will benefit close to 14 million poor households based on the national targeting system of the DSWD, which is also the basis for identifying its beneficiaries for the conditional cash transfer program. Health Secretary Enrique Ona said the poor will have greater access to better health care, especially in emergency cases, which will cover hospitalization, medicines, and doctors' fees. This will be implemented in all government hospitals from the local all the way to the national level.
The premium of these families will be paid for by government, so that when these families need care in a hospital, then they will be covered by PhilHealth. And of course, the coverage will depend on the disease. At the same time, it gives all our government, eventually even our private hospitals, the protection of a poor patient not being able to pay anything at all.
Next year's budget will also cover enhancing the medical facilities managed by the government all over the country, plus the hiring of more medical workers to include doctors, nurses, and midwives. Ona said the president is committed to the best healthcare delivery system for our people.
Our hospitals, our government hospitals, were not only poorly funded, they were also poorly managed. And that's the reason why I'm saying I am also proposing a bill that will reform the governance of our hospitals.
For the People's Television Network, this is Freddie Abando reporting.